In our school it would be the kind of unpopular people that would smoke.
Just seen people smoking around, so I'm not sure if they're regular or not.
I'd say that most people who try it tend to just stick with it, you know.
Tobacco advertising and marketing has a very powerful influence on young people's attitude to smoking. It increases susceptibility, it increases the likelihood of experimentation, and ultimately it increases smoking prevalence. Between 2003 and 2005, smoking advertising was effectively banned across the UK, but point of sale advertising wasn't, and what this meant was this was the last legitimate place where tobacco could be advertised by the tobacco companies. So the UK became one of the first countries to ban point of sale advertising in supermarkets from 2013, and then from 2015 onwards there was a comprehensive ban and displays were covered up in small retailers. A ban on point of sale advertising is very important because we know that it influences young people's initiation into smoking, and it also increases impulse buying amongst adult smokers who want to quit.
I'm working on brand awareness, and so far we have done some preliminary analysis.
The display study is a 5-year longitudinal study funded by the National Institute for Health Research. It was set up to evaluate the impact of the ban on point of sale advertising. There are 4 components to the study, which is annual collection of data on the location of retailers in our 4 study communities, the collection of marketing data through discrete retail audits to look at how displays are actually presented, a survey of school children to look at their attitudes to smoking, their smoking behaviour and exposure to tobacco advertising, and finally focus groups to hear the actual words and experiences of young people.
I know a few people who are regular smokers.
The young people gave us quite a lot of their time and their views over the course of 5 years. First few years the displays were still uncovered. At this point they described the displays as being very appealing, very colourful. They liked the branded packs. They described it as looking like an adult sweetie shop. Fast forward a few years to after the display ban has come in. At that point they then say the displays are dull and nondescript and bland. Standardised packs came into shops in May 2016. We asked the young people what they made of these. So they all had seen them, and when you asked them what they thought of them, they didn't like the colouring. They described them as being olive green or like sludge green. They found the graphic imagery very unappealing, were very off-putting.
Brand awareness is about young people recognising and recalling brands of tobacco products, cigarette packs, etc. What we found before the ban is that we know that young people who can recognise more brands of cigarettes are more likely to be susceptible to smoking. After the ban, however, we found that young people are less exposed to cigarettes in both supermarkets and in small shops. We found a decline in young people saying that they're seeing cigarettes, as we would expect after the shutters go down, less aware of brands.
Previous research has found that children living in neighbourhoods that are more deprived are 47% more likely to smoke than those in more affluent areas. And this is partly due to the greater availability of tobacco outlets within their neighbourhood, which makes it easier to procure tobacco product. It's also more socially acceptable, and the price is often reduced due to the competition between different retailers. We found that the point of sale ban reduced the level of tobacco exposure among the 4 communities. Crucially, what we found was that the difference in exposure between the most deprived and least deprived neighbourhoods had vastly reduced. The Scottish Government is committed to a tobacco-free generation by 2034. One of the ways they can do this is to look at the licensing of tobacco, and also to restrict tobacco retailers in certain neighbourhoods to reduce the inequalities that we've seen in our study.
We conducted observations in 24 shops in our comparison study communities, and we found very high levels of compliance. We found that 98% had covered up their tobacco products.
Yeah, good to see you again. A few questions about display again, if that's okay.
We found that, unsurprisingly, after the display ban came in, that the visibility of the products reduced substantially. But interestingly, the visibility of the storage units didn't reduce quite so much. You still had these big storage units in a very prominent position in the shops, often with cues denoting that tobacco was for sale. We know that for many years tobacco companies have offered retailers financial incentives in return for having their brands in stock, for displaying them prominently on the gantry and as a reward for selling them. We found that they've carried on. They're still offering retailers payments and gifts in reward for having their brands available. One option would be to actually prohibit payments from tobacco companies to retailers, and this was actually included in Quebec in their recent legislation on point of sale display of tobacco products. Another option might be to incentivise retailers to stop selling tobacco altogether.
The issue of e-cigarettes arose spontaneously in focus groups in our first year of data collection, so we decided to include items both in the marketing audit and also in the school survey. What we found was that young people who had tried e-cigarettes but had never smoked were more likely to initiate smoking in the following year than young people who'd never tried e-cigarettes. What we found in our study was it was young people who were least likely to smoke based on their baseline estimate of their susceptibility to smoking and whether they had friends who smoked. And this traditionally is not the group who we anticipate would initiate smoking. What we'll be able to do in future work, we'll do a pathway analysis which allows us to analyse the factors which influence this transition from e-cigarette use into smoking. The display study is one of the most comprehensive evaluations of public health policy. We will continue to work on the data in the coming years, and the findings will be of great influence on tobacco policy across Europe. We know at present about 80% of the population are still exposed to point-of-sale advertising, and ultimately we hope that our findings will influence the tobacco policy across Europe and elsewhere.